Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Complications of neuraxial or spinal and epidural anesthesia. So first let's look at the adverse or exaggerated physiological response. So this is adverse effects of the exaggerated physiological response. So under this it can be due to the urinary retention. So it can be due to the urinary retention. Next is it can be due to the high block. So urinary retention, it can be due to the high block. Next is it can be due to the total spinal anesthesia. So you can call it the total spinal anesthesia. Total spinal anesthesia. And this is along with the epidural. This is along with the epidural. Next is the presence of the cardiac arrest. So it can be due to the cardiac arrest. And then the anterior spinal artery syndrome. Anterior spinal artery syndrome, as well as the Horner syndrome. Next, let's look at the complications. The complications related to the needle and the catheter. So complications related to the needle or the catheter placement. So what is the answer here? Here it may lead to the backache. So can cause backache. Next is the dural puncture or leak. So under the dural puncture or leak, it may be due to the postdural puncture headache. So postdural puncture headache as well as the diplopia. And lead to diplopia. Diplopia, there is involvement of the sixth cranial nerve, and it is most commonly which is affected. Next, we look at the neural injury. So the neural injury, it can be due to the nerve root and the spinal cord damage. So it can be due to the nerve root or the spinal cord damage. Next is bleeding. So under this bleeding, it may be due to the intraspinal or the epidural hematoma. The intraspinal or the epidural hematoma. Next is misplacement. Misplacement, it can be due to, it may be due to the inadequate anesthesia. It is due to the inadequate anesthesia. It may be due to the subdural block, anesthesia, subdural block, as well as the intravascular injection. Then we move on to the inflammation. Under inflammation, it can be due to the arachnoiditis. It's due to the arachnoiditis. Next is infection. Under infection, it will be due to the meningitis or the epidural abscess. Next, we move on to the drug toxicity. So drug toxicity may be due to the systemic local anesthesia toxicity. It is systemic local anesthetic toxicity. So here it is nothing but the epidural, which is greater than the spinal. Next is transient neurological symptoms. There is transient neurological symptoms. So transient neurological symptoms, it has lidocaine, chloroprocaine with preservatives. So it has presence of lidocaine. Then it also has chloroprocaine, and this is with the preservatives. Then is the cauda equina syndrome. That is the lidocaine. To learn and grow daily like this, please do subscribe.